CDC out with some shocking news revealing that opioids are the main contributor to deaths from drug overdoses. In 2015 alone, over 33,000 people died from opioid use. New Jersey's Governor Chris Christie, he joined us yesterday on the Curvy Couch, and he spoke about New Jersey's own struggle with drug addiction. Listen to what he said.
Last year in New Jersey, 4 times the number of people died of a drug overdose than were murdered. 3 times as many people died of a drug overdose than died in an automobile accident. This is an epidemic, and we need to understand that this is a disease. It's not a moral failing, it's a disease.
New Jersey is among many states dealing with this epidemic, so could drug firms and drug companies be to blame for this problem? Here to weigh in on this is radiologist Dr. Nicole Saphier. Thanks, Dr. Saphier, for being with us again.
Good morning.
Is he, first of all, for folks at home that don't know, what is an opioid? What are some examples?
Some common names that people know, household names, are Vicodin, Percocet, Lortab. There's a plethora of drug names, but those are the most popular ones.
Painkillers. Is Chris Christie, is he spot on?
Chris Christie definitely hit the nail on the head when he's addressing the opioid crisis. I mean, without a doubt, we are in the midst of an unprecedented opioid epidemic nationally. When he was talking about it, as we mentioned, 33,000 people in 2015 died alone due to opiate-related overdoses, and that's 4 times what we were seeing in 2000. So there's definitely a crisis. We're in the middle of it, and it would be remiss for us to keep ignoring it.
What about his solutions to the problem? He wants to tell doctors they can't write as many prescriptions for these painkillers.
To say that there's an easy fix to this would be extremely negligent. To be honest, less than 20% of people who overdose on opiates are actually those that are appropriately taking their opioid medications for chronic pain, such as cancer pain. These are unrelentless pain that people need medications for their quality of life. My concern is if we take away prescribing rights, then these patients are going to have a significantly decreased quality of life and a decreased life expectancy.
Chris Christie was saying yesterday that sometimes if you're addicted to these painkillers, it leads to heroin. We can put up some of the statistics. They're pretty staggering. The one that shocks me the most, 580 people start using heroin every single day in our country. Why are we seeing an uptick in this?
Absolutely. So 3/4 of people who do go to heroin say that they were originally on prescription pain pills. Now, about 80% of those people, or 75 to 80%, were not using their own appropriate prescriptions. They were using someone else's. And this is the big problem. This is diversion of medically necessary pain medication. So what's happening is patients are getting their prescriptions, but other people are abusing them, or they're getting them in the wrong hands. So what we need to do is stop that. It's not necessarily limiting the appropriate use of pain medications. We need to make sure that this diversion doesn't take place.
Who is to blame for this? Because some critics are saying the drug companies are. They're trying to profit off of people's addictions.
Sure. Well, to say that the drug companies are to blame would be a very small, narrow vision. It's a multi-pronged answer. A lot of people. Would I be incorrect by saying that there are some physicians inappropriately prescribing? Absolutely, but those are few and far between. We really need physician education because managing patients' pain is very complex. It's not as easy as just throwing pain medications. So physician education. We need to make sure that patients, once they have medication, if there is anything left over, that they have the appropriate way to dispose of it so it's not just hanging out in the house. But heroin, fentanyl, all of these illegal alternatives that people are turning to, that's coming from our southwest border. So we need strict border control there so it's not as easy to access these illegal alternatives.
And it's not fair to penalize the people who really need the drugs that are using it the right way because some people aren't responsible.
Absolutely, and by restricting doctors' prescribing rights, you're doing just that.
Exactly. All right. Thanks, Dr. Saphier.
Of course.